so the recording is going to start now. Everybody who is here, I really appreciate you being here with all the internet difficulties we have. I'm going to go ahead and take a screenshot with my phone right now of who's here for attendance. If I miss you, because people join in a little bit, I'll have to just do it again. But yeah, you're all here, so we'll just do it. And for anyone who's not here, they can do the recording. And thank you for taking a little bit of your lunch break on a hectic, crazy day, and we'll all get caught up on our next gen documentation later. So I actually, I modified today's presentation a little bit. I was originally planning for it to be about communication with patients, especially patients that are difficult to communicate with. But I modified it out to be about effective communication with all of us. So with our colleagues as well as our patients, because I think that that's a really important part of patient care, is how we communicate with the rest of our team members. And our team is really big, right? So it's it can be the nurse or MA that you work with as a provider, as well as a behavioral health provider. If you work closely with them, our team includes lab, includes security, people who are scheduling, the front desk, the business office. We're all part of the team that provides healthcare. So some of those people are more or less involved in healthcare decisions, but we're all part of the team. And communication is an important thing for everybody to think about. And I think it's something that, you know, most of us can communicate better in some way or another, especially on certain days. I know I have bad communication days. And there's a lot of reasons for that. We'll talk a little bit about that in the presentation. So this is kind of a pretty broad. I'll talk a little bit specifically about patients, but we're kind of focusing on communication broadly. So I wanted to start with this quote, which is that when we're thinking of communication, we're thinking about talking and communicating on our end, but a big part of communicating is listening. And when another person is talking, really listening to what they're saying and trying to understand what they're saying instead of just waiting for your moment to talk. So if you're just waiting for your moment to share what you want to share, that's not really communicating. That's waiting for your turn. And so a big part of communication is always that listening part. So start noticing when you do that, because we all do it sometimes, right? Especially if we're busy. I'm like, okay, stop talking so I can tell you what I want. But make sure we're actually hearing what another person is saying to us. So I would like some participation here from everybody. If you can, as always, you can do some audio or you can do the chat. And I would like to hear from people about, I think I can see the chat. I would like to hear from people, yeah, I can see the chat if I do this, okay, about what they imagine a good team member to look like or be like. So kind of like in your head, maybe it's a real person here at Neon, maybe it's a real person from another job, maybe it's kind of like an imaginary really good team member. But what makes a good team member in terms of communication? What do they do that you appreciate? And if you want to give specific shout outs here to people, it's always nice to give specific shout outs to our coworkers of appreciation. So I'll give people a couple minutes to think about it. And like I said, share in the chat. It got me out of presenter mode when I did that. Is anyone writing in the chat? Because I can't see it, but I don't know if that's because I can't see it or because no one is writing it.
Dr. Alto, I have one.
Okay, thank you. Please share.
I feel like a good team member treats their colleagues like they treat the patients.
Mm.
So, kind of like everyone is your customer. So if you would be concerned about being courteous and kind and friendly and kind of making patients feel safe, you would sort of also think about those things with your colleagues who are also human beings.
Yeah, like kind of the same. If you can bring a really like positive, good communicator attitude to the patient part of the team, can you also bring that to the rest of the team?
Right.
Yeah. Yeah, and you made me think of something too when you said, kind of thinking about how you would want to be treated. We've all been patients. So it's always nice to kind of imagine how would we want to be treated as a patient, right? When it comes to that communication, because they don't know our side. And team members don't always know our side either. I'll give a shout out to Valerie, who isn't on this call. I'll tell her later I gave her a shout out, where she did a really excellent communication job the other day when we were having some workflow issues. And she made sure she got the whole team together who was involved with the workflow, the medical provider, the behavioral health provider, and nursing, to make sure that we could solve it together. And I thought that was really effective, instead of everybody talking to each other or just saying, everyone kind of talking or venting about the issue to themselves or to a coworker. Kind of bringing the whole team together to figure it out together was much more efficient, and showed a lot of leadership. So like, that's what I think of when I think of a good team member too, is someone who wants to make it work and is willing to take initiative to make it work when it's not working. All right, I'll be quiet for like 30 more seconds to see if anyone else wants to participate, or if anything's in the chat, if someone could read it, that would be great. I think this is a good reminder too, that if you do have good team members, positively reinforce that. Let them know what they do well. Let them know what's working. So your reminder to tell a coworker that today. So what do healthy teams look like? Healthy teams look like they're founded on respect for each other, including the patient, respect for our different roles and what we bring to the team. Safety is fundamental for a healthy team, right? You have to feel safe speaking up. And that includes like emotional safety, like safe sharing things, safe talking about mistakes. That's really important in a team, that like when you make a mistake, that you can feel comfortable and safe sharing it. And a team is a healthy team. There's also accountability. So holding yourself accountable, holding the team accountable, like, hey, this fell through the cracks. What can we do to make sure that doesn't happen again? This is what I hold myself accountable for. And this is what I hold other team members accountable to, that we're all kind of holding each other accountable and ourselves accountable equal, instead of, in an unhealthy team, there might be more blaming than accountability. Boundaries. So that's really important. So in a healthy team, we're going to have boundaries that are clear and appropriate. People know what types of topics of conversation or what types of things are okay for the team to be dealing with, and what types of things are not appropriate for the team to be dealing with. And that includes boundaries about time, right? So the team understands that when the workday is done, that communication about work isn't going to continue after that point without having like a really specific conversation about that. So there's a lot of different ways you can have healthy boundaries, and that's something that the team can decide on their own. I think boundaries about time, boundaries about topics of conversation, and even boundaries about how you enter in someone's office, right? Do you knock? Do you say their name? Do you wait for them to respond before you open the door? there's not always a right answer for these things, but in a healthy team, we understand what our team members' boundaries are about that, and we respect it. So it's not, again, that there's one right answer about boundaries. It's more that everybody is clear about what those boundaries are. Transparency. So in a healthy team, everybody knows what's going on as much as possible. And if something's going wrong, we're able to talk about that. Be transparent about mistakes, be transparent about workflow issues, etc. And all of this can't happen without clear roles and responsibilities. And I find that a lot of workplace conflict issues and among teams come from confusion about roles and responsibilities. Who is supposed to do what? When people have different ideas about that, things fall apart pretty quickly. And ultimately, a healthy team is going to have shared priorities and values. We want the same things. We're prioritizing the same things. And so that flows a lot easier than when you have team members who have different priorities when it comes to teamwork. It doesn't have to be identical, but there has to be some shared priorities. We all have to be on the same team, right? When it comes to we're working towards the same thing. So what happens when there's poor communication in a team? We all know, we have all seen it. And ultimately, the biggest concern of a poor outcome with poor communication on a healthcare team is medical errors. Medication problems, diagnosis, misdiagnosis, and even really serious negative medical outcomes can happen because of poor communication among the team. And the tools we use for communication, like for example, we use NextGen as a communication tool. And many people have different expectations for using NextGen versus using a paper triage form versus using verbal communication. And if there is confusion among the team about what type of communication you're using, that's a recipe for disaster, right? Also, poor communication, it's not fun to work in a workplace that has poor communication. So there's going to be turnover. There's going to be burnout. People don't want to work as a part of a team that doesn't talk or doesn't talk well. Obviously, it can lead to poor quality care, compromised patient safety, inefficiencies, right? Like if we're not communicating, maybe a patient is sitting somewhere for 30 minutes when they don't need to be. That time it could have been spent, going to lab or getting something else done, or they were supposed to be seen and the provider didn't realize they were there. So it can decrease patient satisfaction and trust, because when you're in there and you tell one part of your medical team one thing, and then you get a sense of something from them, and then that's completely contraindicated by another member of the medical team, that doesn't make you feel very confident in your team. So when we are poorly communicating with each other, patients are not dumb. They can see that. They show that they are aware of that is happening, and it can impact them in feeling like, they don't really trust us. If we can't communicate well, then what else are we not doing well? So what are some of the common causes of poor communication? Sometimes it's because, I think especially in healthcare, we expect it to be poor. We set our standards super, super low for communication. We expect to not be told what's happening. We expect there to be communication errors. And on one hand, I think that it can be helpful to be aware that communication is difficult. On the other hand, I think that if we just expect communication to be poor all the time, we're going to get what we expect, because we're not trying to make it any better. There's actually a lot of research on this next part, which is that there are more communication barriers when different disciplines with different hierarchy systems are involved. So when there are differences in hierarchy, like for nursing and medical providers, and then I always think there's hierarchy with administrative staff. And then I think behavioral health providers are often confusing to the hierarchy. People don't know where we fit in. And when there's hierarchy differences across disciplines, because disciplines often have different values, they've been trained differently, they have different communication styles, that's when communication is most likely to fall apart, is when we're communicating across disciplines and across hierarchy, especially when there's differences in gender and culture, because how we communicate is not in the workplace, has a lot to do with how we were raised, and has a lot to do with our culture And we raise boys and girls very differently in our culture to communicate in very different ways. There's a whole bunch of research about how women's communication patterns are different, and how men respond to women's communication patterns differently than men's. And all of that can contribute to more communication errors. And I think a big issue with communication barriers is fear. We in the workplace, we don't want people to be mad at us. People don't like conflict. And you might not want to talk about a mistake or a problem that happened. Either it was your mistake or someone else's mistake, because you don't want to get in trouble. You don't want to get someone else in trouble. You don't want to experience retaliation or be seen as incompetent, or you don't want the patient to know there was a mistake. All of that can contribute to just silence about an issue, which there is a time and a place for those conversations to happen. But they need to be happening regardless of our fears, because if we don't happen, then that's when the miscommunication causes a lot of problems. So how do we improve in our teams at Neon? I think that you start by focusing on yourself and holding yourself to a high standard for professional communication. And I think that that might look differently for what we all define that as, but I think holding ourselves to a high standard for communication, not just thinking about how other people communicate, but start with you. And then we have to set aside time for communication. Communication will not happen without it being part of the workflow. So that is what a huddle is. A huddle is scheduled team communication time. And there should be opportunities for feedback about how communication is going. So that can be, hey, just wanted to touch base. How do you think we're communicating? What's going well? What's not going well? It could be things like feedback boxes, right? Lots of workplaces have like things where you can submit anonymous comments about things that you would like to see different about the team, or it could be feedback to supervisors. But we want to have opportunities to learn about, what am I doing well? What am I not doing well for communication? And we want to debrief. So when something goes poorly, there's a communication problem, we want to talk about that communication problem later in a non-judgmental way. We want to bring up, be like, okay, so this happened. This is how I experienced it. What can we do differently next time? Or how can we prevent this from happening again? And as much as we can standardize procedures, standardize roles, that helps a lot, right? Because if people know what their role is, people know what the procedure is, there's less confusion around their communication to others. But ultimately, at the end of the day, conflict is inevitable. We're human beings. We're going to have conflict with each other. And it's not that the goal of a healthy team is not to avoid conflict. It's to deal with conflict effectively. Because sometimes people think good communication means avoiding all conflict. If you're doing that, you're probably missing a lot. You're just avoiding all opportunities for conflict. So how do we change our communication? You can't do it without feedback. You can't, it's impossible. So if you have a team member who you want them to change their communication patterns or style in some way, and you have not given them feedback about that, you can't expect there to be any change. Now, we also can't guarantee that feedback leads to change, but it certainly isn't going to lead to change if there's no feedback at all. So if we care about our coworkers and we care about our teams and we care about Neon and we care about patients, we have to give each other feedback about communication and what's working and what's not working and what we need to see when it comes to communication, and just having those open dialogues. So that can't happen without like talking about the communication process. So how do we give feedback? So if it's required, if I'm saying that it's required for healthy teams, then how do you give it? So, let's give some examples of what type of feedback you might be providing. So you might be providing feedback about a workflow issue. This patient was not checked in, or this information was not entered into the chart, or nobody knew what they were supposed to do for this patient. So things got really confused. Those are all feedback communication concerns. So when you're giving feedback, you really want to be aware of yourself and your motives. So if you are giving feedback because you're really pissed off in the moment, that's not the right moment to give feedback. If you're giving feedback because you want to show everybody that you were right and they were wrong, that's probably not a good motivation for feedback in the moment. If you're emotionally overwhelmed in any way, it's not the right time for feedback. So you need to make sure that you have like appropriate motives. Are your motives about improving the team? And are you in the right headspace to give feedback? It should be timely. So like, yeah, sometimes you can't do it right away because of a million different reasons, right? But you want to give feedback sooner rather than later. Like me sitting you down and being like, that referral you sent me to behavioral health a month ago, these are the problems that I saw with it. Like, I guess it's good to get the feedback, but when it's that delayed, it can be harder to benefit from. So try to be timely about feedback. Focus on the facts without judgment or personalizing. So what happened? What was the exact thing that happened? Let's focus on that. So instead of the patient was not checked in, sounds very different than you did not check in the patient, which is your job. Right? So stick to what happened without judgment, without personalizing, so without making it about the other person's character. When we give feedback, we're trying to give feedback on behavior, on communication. You're not giving feedback about what type of person the other person is. That type of feedback is not appropriate for the workplace. You want to be careful of using words like never or always. Those just set people off and they're inaccurate, right? So you never do this. This is always wrong. Instead, focus on a specific incident that happened, fairly recently. And use those shared values. So hopefully you're on a team where you know that you have some shared values with this person. So usually the shared value that we have is that we want patients to get quality care from Neon. So since we both want patients to get quality care from Neon, we're on the same team when it comes to this. So take the conversation from that perspective. And don't just give negative feedback, right? Nobody likes just getting negative feedback. We love to get positive feedback. And that can be, all the research says that positive feedback is actually more powerful at getting a lot of the changes that people want to see. So rewarding something that is going well, rewarding when something goes well will rapidly increase that behavior. So don't just talk about your colleagues, just give them feedback when something goes wrong. Do it when something goes right. All right, so how do you receive feedback? Feedback is going to make you defensive. You're a human being. Everyone gets defensive. That's okay. Expect it. Breathe through it. Take some deep breaths. Notice that you're feeling defensive. And notice that that's normal. And I'm sure we can all think of a time right now where we've gotten really difficult feedback that was hard to hear, especially I think in the type of training that we do. Medical training, from what I hear, and I know that my training as well, you get a lot of feedback. feedback all the time. Doesn't mean it always gets easier. But think about some time that someone gave you difficult feedback, but in a really helpful way. Try to be like that person. What did they do that made it easier for you to hear that feedback? So when you're getting feedback, you always, whenever possible, want to reinforce that the person is talking to you about this. Because remember, we want feedback. We want to be better. So thank you. Even if you disagree with the feedback, thank you for sharing this with me. Thank you for talking to me about this concern. And validate the other person's concern. Again, even if you disagree with the feedback, find something that you can validate about that. Like, you care about patients, so that's why you brought this up to me. And thank you for sharing it with me. Sometimes we might need a minute to process it and be like, I just need to think about this more and I'll get back to you. Think of it as an opportunity to grow. And if you disagree with something about the feedback, try to separate out, is there parts of it that you agree with it, parts of it that you don't agree with? How or why do you not agree with that? And try not to have that be driven by that strong emotional reaction if you're having one. And so try to focus on the facts and not emotions. And a lot of times people respond to feedback by attacking the other person because it feels like an attack. Like you feel like you're being attacked, so you want to attack back. that's not a really helpful pattern. And even sometimes you feel like you're being attacked because the other person is being attacking, right? They're not delivering feedback in a constructive way. But that doesn't mean you have to reciprocate. So try to find the part of the feedback that you want to learn from and you want to grow from, and focus on that. And we're going to talk more about how, like, when people are being attacking, how you can maybe change the tone. And if you are having a lot of difficulty with feedback that you get in the workplace, like, debrief, talk about with someone outside Neon, right? So don't go to like another Neon colleague and be like, you won't believe what X said about me. You know, try to keep that limited, because then it can really grow, but it makes sense that you want to talk about those things. Everyone does. But try to talk to them about someone who isn't as involved, right? Someone outside the pocket here. So when we have bad behavior, which we experience from patients, and then we might also experience from colleagues. So really inappropriate and bad behavior. So like yelling, name calling, things that are not okay when it comes to communication. We want to respond to that by calling out the bad behavior, but in like a calm way. And be clear about those boundaries. And I'm going to talk a little about how to do this a little bit differently with patients who are really escalated. And to that, everyone just wants to be validated. Usually when people are acting out badly, it's because they're really emotional. And so validating those emotions can take people from like a 10 to a 1. And I see it happen all the time. People are so upset, and they're yelling and they're blaming and they're mad at everybody. And I just say, you know, this is really difficult for you. It really makes sense that you're upset right now. And they just sit down and they're fine. So validation can go a long way. And, you know, sometimes we need to set boundaries. So especially with coworkers who are using bad behaviors, we want to say, like, you know, this is not appropriate. And if it continues, I'm going to calmly say, you know, oh, if this is happening, you know, this keeps happening, I can't keep having this conversation. And that's okay. That's okay when someone's responding with, you know, bad communication behavior, like yelling or name calling or things like that. You don't have to participate in that. But I do find that modeling an appropriate tone of voice goes a long way, because people tend to match. So if someone's yelling and you start yelling, everyone's going to keep yelling. If someone's yelling and you get quieter, people tend to get quieter. So oftentimes we see conflict escalate. So communication about something, either there's a mistake been made or there's just bad news. A patient doesn't want to hear that they have to wait 10 more minutes. Or somebody doesn't want to hear that they messed up something in next gen right then. So what causes things to escalate? When people are really being driven by negative emotions, when people are trying to win. So when we have a conversation and you're trying to win the conversation, you're probably going to escalate a conflict. If you're having a conversation and you're trying to understand what happened, it's less likely to escalate. Defensiveness, lack of trust, you know, emotional baggage. Sometimes we are bringing something to a conflict that has nothing to do with this conflict. We're really mad and upset about other things in our life, and it's coming out in this conflict, and that happens to everybody. But it can lead to more escalation. And if we don't have a desire to understand the other person, then, and their experience, that's going to lead to escalation too. So these are just some things to think about for when situations escalate. What was contributing? So here's some really solid, concrete things you can do for communication for yourself, right? So we can't make other people do these things, but if you're doing these things for you, it can model appropriate communication for others. So general communication tips are: avoid that bad behavior like name calling, negative tone of voice. I really try to pay attention to my volume if I'm getting louder. I really try to check in with myself and make sure that I'm okay before continuing that conversation. When you feel like a conversation isn't going anywhere, it's okay to be like a broken record. And by that, I mean, like, you pick your communication point and you stick to it. You don't go off into a different topic. You don't try to justify it or get really deep into why you feel that way. You just stick to, oh, in the future, I think it would be really helpful if X, Y, Z happened. In the future, I think it would be really helpful if X, Y, and Z happened. And you just stick to it. Keep it simple. The other person might go all over the place, but you're keeping it focused on the communication that you wanted to get across. And that can be really helpful with patients who might be kind of all over the place with something too. Try to assume best intentions. I know this is hard, especially if you're like, pretty certain the other person doesn't have good intentions when their conversations with you, but assume that they are trying their best, that they also care about the things you care about, and try to find that common ground. So my common ground with patients who are like totally annoyed in the waiting room about having to wait a long time, like my common ground is that I want you to have a better experience here too. Whether or not I have control over that is a completely separate issue, right? Whether or not if it's anybody's fault, also a completely separate issue. But I also want you to have a good experience here. Like we have common ground in that way. I like to use the example of like, if you've ever like ordered something at a restaurant and they bring it out wrong and just like completely wrong, right? So your order's all messed up and you didn't realize till the waiter or waitress left the table. And then you're really worked up about it. You're like so annoyed, like they got this messed up, and you're prepared to, really kind of take it out on them and just be like, this is unacceptable. How dare you do this? You guys really need to get my order right. You're all worked up. And then they come over and you tell them and you're like, look at this is wrong. And the server is like, you're absolutely right. You're done. You're not going to yell at them anymore, right? When someone gets on your side, it tends to de-escalate conflict. So as much as possible, can we get on somebody's side? You are absolutely right. Or, wow, you really don't want this. You wanted something else. It really changes the whole tone of the conversation. And then you can get into details after that, but really getting on people's side as much as possible. You've been here a really long time. That must be really difficult. I wish that was different too. So drop the rope. That gets into when we're trying to win. So when you feel like you're in a rope conversation, so I'm pulling on the rope, you're pulling on the rope, I'm pulling on the rope, you're pulling on the rope, drop the rope. So stop trying to win. Because when you're pulling back and forth on the rope like that, nobody is winning. You're just escalating. As much as possible, use I statements. So in any sort of conversation, if I say you do this, you do that, that doesn't feel good. No one's going to respond well to that. So as much as possible, focus on I prefer, I like to see, this is what I do, this is how I feel. You're just sharing your experience with somebody else, and then they can infer what that means for them. But you don't tell them about themselves. Try to avoid that. And try to avoid comparisons, like, across people or like with yourself, because I think that can make people feel just not good about themselves as well. We don't like to feel like we're being compared to others. Instead, focus on those facts, focus on the common goals. Try to keep things in perspective. Sometimes these conflicts blow up to much bigger things, and we want to remember to keep it in perspective of the workplace and what we're doing here. All right, so for difficult patient interactions, and I know we're a little bit over time, so I will try to keep it short because we started late. For difficult patient interactions, be aware of your own emotional response. Just take a deep breath before responding. Try to avoid defensiveness, try to avoid blaming others, like, hey, this is lab's fault. Hey, this is the doctor's fault. This is the business office's fault. Instead, try to be on the same team. And that doesn't mean patient versus us, right? Try to get on the same team as the patient too. Like, we're all on team. Let's get you the medical care that you need. And this is how we can do that right now. Validate and emphasize. So just really focus on, this is difficult. I'm so sorry that happened. That doesn't mean you're excusing their behavior. It doesn't mean you're saying that Neon did anything wrong. You're just saying that you're sorry it happened. That's oftentimes mostly what people want to hear in a difficult patient interaction. I'm sorry this happened to you, whether it's something that involved Neon or not. Don't match the patient. So patients are going to have the raised tone of voice. They're going to have, maybe some aggressive body language or agitated body language. You want to do the opposite. You want to be calm. You want to talk slower. You want to be relaxed. You don't want to be like stepping up to them or getting closer. You want to be modeling the type of body language and voice that you want to see from them. And ask yourself sometimes in a difficult patient interaction, like, hey, is this me? Like, am I bringing something to this interaction that's making it difficult? I just think that's really important for accountability. And oftentimes, if you can pass off a difficult patient interaction to behavioral health or a center director, like that's appropriate. It's not your job to deal with a litany of patient complaints. There are other people who can deal with that, and just give them an opportunity. Like, would you like to talk to somebody more about this? Let me see who I can find for you to talk to. And when you need to set boundaries with a patient because it's escalating and it's just not getting better, you can just do that politely and firmly. And that's also, sometimes that's when security is getting involved as well. And security is hopefully also politely and firmly setting those boundaries for appropriate behavior or not. And we can't de-escalate every interaction, but there's things that we can do. So ultimately, this is what I want you to not forget. Your responsibility is your words, your behaviors, your actions, and the consequences of that. That's you. Other people's words, other people's actions, the consequences of that, other people's mistakes, that's not your responsibility. So all you can focus on are the things that are your responsibility, which is your behavior. And I got to tell you that when you do that, when you think this way, it's really freeing. And it can take a lot of the stress that comes along with poor communication off the table when you know that you're focusing on what you can do best. And letting go of the things that you don't have control over, which is how other people communicate. So these are just some general things that I thought would be helpful for people to know about communication. I think it's really hard. I can't emphasize that enough. We talk about it like it's easy, but it's not. It's not. It's really hard to communicate effectively, especially when a lot of us, myself included, are working in like new teams right now, right? So working in new settings, new teams, or I know a lot of you, when you rotate to different centers, are working with new teams all the time. And when there might be a lot of staffing changes, it's always a new team when there's a lot of staffing changes. So this is not easy. It actually takes a lot of work, but I also think it really pays off. So I'll be sticking around like always for conversation and chats. So you can, I'll stop sharing the slides. So you all can stick around too. I don't know why I couldn't see the chat when I had the PowerPoint up. Now I can see it again.